Hi, welcome to a brief overview of how to admit a patient from the emergency room. Patients in the emergency room should be admitted with admitting orders in the overflow location. So make sure that you have the overflow tab selected. And so we'll go into this fake patient called surg or PSR. And so you would double click on the patient to open the patient's chart, in which case you would see the patient's profile. You would have at this stage already examined the patient. You'd click on orders, which will show you the orders profile of the patient, and then you would click on the add button up here. So as you click the add button, you will notice that the add window opens, and you would click on power plans and then a basic admission to med-surg unit. So this power plan that says admission med-surg is what you would select. Alternatively, ICU is the other one that frequently is used to admit a patient to the ICU. And then of course there's a hospice admission as well. And then there's various different diagnostic specific admission order sets that you could use in this folder. So let us go into the generic admission med-surg order, a power plan. Click Done to close your search box. And you'd notice that up here the admission med-surg initiate pending power plan has opened up, and then there's a subphase called VTE prophylaxis, which needs to be assessed on every patient. So I will click back on the main power plan and kind of review. I'm going to close these windows to kind of review this power plan. Admission status is needed to determine appropriate level of care, and that is the first order. And notice there's a blue colored sign that says you need additional order details to fill out. So one would select that order, right click and modify it, and then an order sentence window would come that delineates admit to inpatient, put the patient under observation. Is this patient going to be admitted to ambulatory surgery, or are they going to be going to an extended ambulatory surgery? So in this case I'm going to use admit to inpatient as my option. And so the window has now populated admit to inpatient with appropriate clinical reasons for inpatient level of care. You could alternatively click in this window and type whatever you would like as the reason to put the patient into an inpatient level of care. Most of the time this is a guesstimate where it says a yellow window where you must define post-discharge plans. Expected post-discharge plans could be to home. Alternatively, you could type nursing home or any other location where they need to be going, or any other things that are needed to discharge this patient appropriately. So I've minimized the order detail window for admission status. Next thing is patient condition, and you can select from a drop-down of stable, poor, fair, critical. Maybe I would say fair in this case. And so the order detail window opens up saying that we've selected fair. Next is resuscitation status. So if this patient is full code, I would select this window, and I have a drop-down of the different code statuses that are available. Maybe this patient is a DNR, in which case a DNR window opens, and then you must define if you filled out the DNR paperwork. And in this case you could say, no, I didn't fill it out yet. The next two orders are pertaining to transferring to a patient to a cardiac bed, a monitored bed or not. So if the patient is currently not on a cardiac monitored bed and you want to transfer them to the cardiac monitored bed, you would select both of these orders, a transfer to order and a cardiac monitor order. If you don't wish to do that, just leave it alone and the patient will go to an unmonitored bed. So let's assume this patient is not on a monitored bed and not scheduled to go to a monitored bed, and you want to transfer the patient to a monitored bed. You'd select both orders. You would modify the details, and you would say bariatric, no. Unit, you might say surgical. Sitter, you may say no, in which case everything else is appropriate. This patient's going to go to a surgical bed, which is going to have a cardiac monitor. The next thing to think about is VTE prophylaxis, and that is pre-checked for us. And this is considered a sub-power plan or a sub-phase, in which case it's listed on the left. You would click on this power plan and you would unselect the reason why the patient did not get VTE. And then you would actually put the patient on VTE prophylaxis, maybe SCD boots. to legs bilateral. Or maybe you may select one of these medications to use for DVT prophylaxis. The key is to unselect the reason VTE prophylaxis not received, to unselect that order. Next comes general diet. So let's say we put them on a general diet. Maybe we want a routine intake and output. And per our hospital committee, we've recommended that a physician order be placed if the patient has watery diarrhea, so that the nurse can send it off for C. diff automatically in case there's a C. diff infection noted upon admission. Next, you can select different fluid rates. So let's say we selected normal saline, but let's say we didn't want 100 mils an hour. Let's say we wanted 80 mils an hour. How would I change this? I would right-click, modify, and the IV fluid window opens where you can highlight the 100 and change it to 80. And notice 80 hit here, and then I would minimize this window, and notice when I minimize the window, it went to 80 mils an hour. Next would come any PRN medications, Tylenol for pain or fever. Maybe I would want a Norco involved for additional pain. There's Zofran and Melcomag for any PRN reasons. Now, this order set does not have lab tests, and so we can add lab tests to this order set. You'd click Add to Phase, Add Order, and a window would open where you could go to Labs and say maybe I want BMP for tomorrow morning. So T+1 0300 is tomorrow morning's BMP, and maybe I would like a CBC with diff tomorrow morning. Click OK. So now I've added a BMP CBC. What if I wanted NPO after midnight? So I would type NPO here, and I would select NPO, and here's the after midnight option for a procedure tomorrow. So that's how you would add additional orders. Maybe I want an EKG tomorrow, an EKG, and then there's a pre-procedural EKG. So here's how you would order additional orders inside this order set. One can type in pre-procedure, pre-surgical clearance. This isolation code is usually done by the nurses. You wouldn't have to do it in a typical patient. So now I have basically seen that there's an admission order set. Notice there's an additional detail that will get filled out later. That's the diagnosis, why the patient is here. So we've kind of highlighted the orders. Remember, used Add to Phase to add orders. And finally, we're ready to sign off these orders. So I'd click Orders. So I've clicked Orders for Signature down here to have the system start processing orders for signature. And notice there's a one missing required detail here. I would click one missing required detail, under which you can a diagnosis is needed for this patient. Now you could pick any of the existing diagnoses that others have entered in this practice patient, or you could click Add and add your own, and maybe there is cellulitis in this case. I would search for cellulitis, click the search option, and I would select cellulitis here. Click OK, click OK. So notice how cellulitis got added, and it is added down here under 1. So therefore you've now admitted this patient for cellulitis. We have to remember to click Sign. So we've entered all the orders for this patient. Click Sign, and it will go through a series of duplicate checks. So it's saying that currently the patient's on general diet, but they're going to be on NPO after midnight. So it's saying you have 2 diet orders, in which case you would say order anyway. It's okay to do that. So it's notice on the bottom it's signing all orders, and you have successfully then completed the admission orders on the patient. Remember, they have to be in overflow to do this. The other thing I would like to point is you need to do admission medrec, and you would do it here under reconciliation admission, in which case it will load the patient's current medication. So we've ordered acetaminophen, Norco. Lasix was brought from home, and it was previously defaulted to discontinue, but maybe we want to continue Lasix. So you would say continue Lasix upon admission. The reason I know that is because there's a scroll bar here that's a home med, and then I've converted this to a inpatient med. Another one is naproxen. Maybe I want to discontinue that naproxen, and the potassium I might want to discontinue. These inpatient meds we don't need to worry about because we just ordered them. It's only the scroll item that we need to worry about. And then you'd click reconcile and sign, and you would have done admission medrec. So to reiterate, open a patient in overflow, select the admission med-surg power plan, place the admissions med-surg power plan, perform admission medrec, and then you would have completed the admission for this patient. Thank you.